Welcome to Wednesday's edition of COVID-19. There has been a concerning surge in cases today amid an outbreak among some foreign workers here in the country. Now, we have more on this cluster infection and on the vaccination campaign here and elsewhere around the world later on the program. We begin with the pandemic updates. So, do start us off with the local coverage then.
Sure, Sunny. We have a surge by exactly 100 new COVID-19 cases compared to yesterday, with 444 infections as of 12 a.m. this Wednesday. And for domestic transmission, it's an on-day hike by 107 cases at 426. So the country's daily caseload has now risen again to the 400s after being at around the mid-300s for 3 consecutive days. And with that, the nation now has a total of 90,816 infections, and with 6 additional fatalities, the death toll at 1,612. Now, cases are dominating the metropolitan region, with more than half of today's cases reported in Gyeonggi-do province. And the reason for that is because more than 100 infections were reported in Gyeonggi-do province's Dongducheon, including more than 90 foreigners. And this comes after mass preliminary screenings were conducted on thousands of foreigners working in that region or residing in that region. Now, the government has been running 17 makeshift screening centers on the heels of outbreaks among foreign laborers, and also vowed to do more. Take a listen.
11,000 manufacturing facilities that employ 5 or more foreigners and have dormitories will be subject to on-site inspections.
So far, the Labor Ministry has inspected some 180,000 businesses since November, with special probes into 100 agriculture and dairy farms and 500 construction sites in February. Officials are reminding the public that anyone can be tested for the coronavirus regardless of their status, meaning undocumented foreigners do not have to be concerned about being punished or deported. Authorities also called on businesses to comply with strict prevention measures and help foreign workers to understand and follow them.
I see. So, meanwhile, on the vaccine front, it's day 6 of our campaign, and I hear quite a number of people were vaccinated yesterday alone.
Right, Sunny. Let's take a look at the updates on the vaccination front. We had some 63,644 people vaccinated on Tuesday, raising the total to 87,428. Now, there's been also some unfortunate news. One patient at a long-term care facility who was inoculated with the AstraZeneca vaccine died on Wednesday, but no links have been found yet between the vaccine and this death. Now, staying with AstraZeneca, citing recent data and policy changes from European countries, Prime Minister Chung Se-kyun ordered officials to review the authorization of AstraZeneca vaccines for people aged 65 and above. And meanwhile, we learned that today that North Korea is expected to be provided with around 1.7 million doses of AstraZeneca vaccines through the COVAX facility. And also through the COVAX facility, supply of vaccines has started in other countries like in Africa. And if we take a look at Germany here, now Germany says it has around half of its cases are variant cases, which is why it is revising another extension of a lockdown. Meanwhile, the U.S. at some 29.3 million infections here, U.S. President Joe Biden says by May, all U.S. adults will be provided with vaccines. That's what he is expecting. And the total number of cases here now stands at 115.2 million, with a similar rise in new infections as yesterday. But we have a rise in fatalities here, more than 10,000 deaths reported in the span of 24 hours. And that's all I have for now, but I'll be back with more tomorrow. Back to you, Sunny.
All right, so thank you for that. Right, it's Wednesday, so no regular government briefing today. Instead, we bring you more news from the international front. The UK was the first country to launch public vaccinations against COVID-19 in early December. It's been about 3 months since then, and for a glimpse of the situation there now, I have David Cox live on the line. Hello again, David.
Hi, Sunny. Thanks for having me on the show again.
Right, David, now about 30% of the population, that is more than 20 million people there, have received their first dose of the COVID-19 vaccine. Given the current pace, David, when do you expect most in the country to be fully vaccinated against COVID-19?
So the UK vaccine programme has actually hit pretty much all the milestones so far. So the next big step is they hope to vaccinate all the over 50s in the population by the end of April, and I think everyone in the adult population by the end of July. However, you have to remember that this is just the first dose of the vaccine, and you need 2 doses of the vaccine to be completely vaccinated. And I think so far only 4% of the population have had both doses. So in reality, we're probably looking at towards the end of 2021 for everyone in the UK to have had both doses.
I see. David, has the vaccination campaign thus far led to any tangible impact on efforts to contain the outbreak there?
Well, this is the thing. So all the signs are currently actually pointing in the right direction. So both the COVID-19 infection rate and the death rate in the UK are both falling markedly. And I mean, so I think the latest statistics is that the death rate is down by like a quarter on the previous week. And this has probably been driven by a couple of factors, both the vaccine program protecting the elderly, and also the current lockdown preventing more cases from spreading.
David, I also understand 1 in 7 people in England has antibodies against COVID-19. Do tell us a bit more about this finding.
That's the thing. So we've had some new figures released on this. So I think now the latest is that there's 1 in 4 people across the UK with COVID-19 antibodies in the blood. Now, of course, some of those people are going to have had COVID, but I think in a lot of the cases it is because of the vaccine. So, for example, I think at the moment the people in the UK with the highest levels of COVID antibodies in their blood are the over 80s, who are the people who were vaccinated first. So that is definitely, I think, promising and pointing in the right direction.
Right. Also, do share with us a bit about the details regarding vaccine side effects, if any.
I mean, I think so far, the side effect profile seems to be fairly minimal, which is really promising. But I think more data on that, is going to emerge, over the next few months. But so far, I believe, there's no particularly concerning side effects, which are, out of the ordinary. So with any new vaccine, you're always going to get some adverse incidents. But at the moment, it's looking like those are very much in the minimal.
I see. Well, that's good to know. Also, David, authorities at Public Health England have found COVID-19 vaccines, namely those by Pfizer and AstraZeneca, are 80% effective at preventing hospitalizations among those in their 80s. Please tell us more.
Yeah, definitely. Actually, so far, I think the data on this is proving better than expected. So this increased protection for the vulnerable, I think it's one of the main reasons why we're seeing the death rate falling quite a bit in the UK in the past weeks. So that's been really it means brain is greatly reduced.
David, on a rather somber note, a Brazil variant of much concern, I quote, has been detected in the UK. What has been disclosed thus far about this latest finding?
Yeah, so the Brazilian variant, that's had quite a lot of attention in the media over the past a few days. But I think it's important to remember that it's basically just still only 6 cases of the variant. You need quite a lot of introductions of a new variant for it to properly take hold in the population and become a problem. And so I don't think it's a particular concern so far because we've still got the travel restrictions in place. So there's no real evidence that the variant is properly spreading within the population yet, but it's being monitored very closely. Still only 6 cases at the moment.
I see. David, what can you tell us about the approval by authorities there for a study that will intentionally expose healthy volunteers to the coronavirus?
So this is a study which has been planned for quite a few months now. It's called the Coronavirus Human Challenge Trial, and it's a first of its kind in the whole world. It's quite controversial, I have to say. So the whole idea behind it is to try and get some concrete data on exactly how much of the virus it takes to cause an infection, and also how rapidly it spreads from person to person. And if that proves effective, then they're going to try and look at it to assess which vaccine is the most effective, which treatment is the most effective over the coming months. But the big question is it going to lead to any safety concerns? So it's being done in 18 to 30-year-olds. So these are the parts of the population who should be the least vulnerable to the coronavirus. But still, if someone actually does fall seriously ill as part of this trial, there could be some major ethical questions around it. But the hope is that basically having a really controlled trial will basically be able to give us some data about the coronavirus we haven't been able to find so far.
Right, we'll keep our fingers crossed for that. One final question before you go, David. I believe the UK is planning to lift all COVID-19 related restrictions by mid-June. Now, this initiative is starting with the opening of schools next Monday, I hear.
That's right. Yes. So schools have always been like sort of big priority for Boris Johnson. So next Monday, pretty much all children are back to school, and then there's basically just like a slow, like so kind of relieving of restrictions over the next few months. So I think by the end of March, groups of people are going to be able to socialize outdoors again, and then next month you're going to see lots of shops and businesses gradually reopening, and then basically like so pretty much all social contact restrictions being removed by mid-June. So things are going in the right direction, definitely lots of in the UK, but it's going to be fairly slow over the next few weeks, but then by April and May things are going to start accelerating a little bit more.
Right. All right, David, as always, thank you very much for making the time to join us live at this very early hour at your end.
Thank you so much.
Right. Meanwhile, President Moon Jae-in has reaffirmed the government's stance regarding the safety of current COVID-19 vaccines. For more, I have Kim Han-il here in the studio. Welcome, Han-il.
Good afternoon.
Right. Let's start with the president's remarks then.
Sure. So during a cabinet meeting yesterday, President Moon Jae-in said the government will take full responsibility of the vaccines being administered here, regardless of their manufacturer. So he called on the media and the country's political stakeholders to be wary of fake news related to the vaccines. One example of this mentioned during the government briefing today was a rumor claiming that AstraZeneca vaccines are only 8% effective on people over 65. The president also added that the vaccine rollout marks the first step in a journey towards the resumption of our normal lives, and that herd immunity would be achieved by November. President Moon also asked for cooperation from the National Assembly to make sure that there are no delays in passing the budget to urgently help those in financial need. The government and the ruling Democratic Party are aiming to provide 19.5 trillion won, or roughly 17.4 billion US dollars, to be spent on pandemic relief.
I see. Hannah, tell us a bit about how that money is slated to be used then.
Sure. So the 19.5 trillion won package includes an extra budget of 15 trillion won, which is around 13.3 billion US dollars, which the government is proposing to the National Assembly tomorrow for approval. The majority of the budget will be spent on supporting small business owners and low-income households, while roughly 27% of this extra budget, which amounts to 4 trillion won, will be earmarked for the country's vaccine rollout, with 2.7 trillion won being used for the purchase of additional vaccines. This proposal comes after the government decided to buy more vaccines than what they had initially planned. The government had earlier sought to acquire enough vaccines for 44 million people in its original budget proposal. However, it has since decided to purchase extra vaccines for an additional 35 million people, bringing the total to 79 million people's worth. The extra budget proposal will be submitted to the National Assembly on Thursday after being reviewed by President Moon's cabinet.
I see. Also, Hannah, I understand authorities here are looking into the possibility of issuing vaccine passports.
Right, so the Korean health authorities are considering the distribution of immune certificates to allow people who have been vaccinated to travel more freely. However, there are some hurdles that needed to be overcome. A senior health ministry official, Yoon Tae-ho, said during an online briefing yesterday that relevant authorities are looking into the proposal to issue vaccine passports, but they still need to draw up clear guidelines. For instance, officials need to determine whether separate quarantine rules should apply to foreign arrivals entering Korea with a vaccine passport. Yoon added that similar discussions are also taking place within countries that are looking to issue vaccine passports as well. He stressed that careful planning was needed in order for the system to work and before it can be scaled up globally. Meanwhile, the government is also considering measures to ease entry restrictions for people who have tested negative for COVID-19 upon arriving in Korea. Finance Minister Hong Nam-gi said during a meeting with economic officials today that the government will seek to create a travel bubble or selective border openings with neighboring countries that have relative success in containing COVID-19. in order to help the country's struggling airline industry.
I see. All right, Hannah, as always, thank you very much for that coverage.
Thanks for having me.
Right. Public vaccinations against COVID-19 began last Friday here in the Greater Seoul area. And starting today, regional vaccination centres outside of the metropolitan region are also launching their own inoculations. Well, we visited one such centre earlier on. Do take a look.
화이자 백신 11만 7천 회분이 우리나라에 도착합니다. 이 물량은 곧바로 27일부터 코로나19 환자 치료 의료인들에게 접종될 것입니다.
Suncheonyang University Hospital Cheonan is responsible for providing the vaccines at the vaccination center for the central region. Also, a total of 72 workers, including 12 doctors, 24 nurses from hospitals of each city and region, and 36 administrative workers will be deployed.
Hello everyone, this is Shin Se-byuk. So I am at the Chungbu Vaccination Center, where it's responsible for inoculating those in the central region, including the Chungcheongdo provinces, Sejong City and Daejeon City. Let's take a look at how vaccines will be administered once the vaccination program begins.
The vaccination center is set in an indoor badminton court in Cheonan City, and the site is divided into reception, inoculation, and after-inoculation areas. The vaccination center has a number of facilities that meet the government standards. It has secured enough space for a mass inoculation as well as proper implementation of social distancing guidelines. The center has separate entry and exit so that it can conveniently distinguish those who have gotten a shot and those who haven't.
The first thing you will see as soon as you enter the center after having your temperatures checked will be the reception area. According to the guidelines published by Pfizer, you are supposed to make a reservation prior to your visit. And upon arrival, you will be asked to fill in a medical questionnaire. And the next step would be preliminary diagnosis. At here, doctors will see whether you can get vaccinated or not, because if you have a fever or respiratory symptoms, you won't be able to get vaccinated. And finally, at here, you will get the vaccine. And after the inoculation, you're going to stay here for 15 to 20 minutes to see whether any side effects or abnormalities appear. And if everything looks good, you're good to go.
The center is capable of responding immediately if anyone shows side effects. And the vaccination center is responsible for training workers at other centers in the regions on not only inoculation process, but also how to respond to potential side effects.
So this center is dedicated to administering Moderna's and Pfizer's vaccines. So of course, you can find an ultra-low temperature freezer here that can maintain the temperature of minus 75 degrees Celsius.
Preliminary diagnosis, inoculation, and observation will all be taken place at one spot, and up to 600 people can be inoculated at the Chungbu Vaccination Center. The Pfizer vaccines, just like AstraZeneca's, require 2 shots. The government plans to finish administering the first jabs by March 20th and the second one by April 10th.
The nation's very first vaccination program officially began. For a fast yet safe vaccine process, all vaccination centers must implement all possible measures and be thoroughly prepared. This has been Shin Se-byuk.
이미 전 세계에서 2억 회분이 넘는 백신이 접종되었지만 부작용 사례가 극히 적은 것으로 나타나고 있습니다. 발생한 부작용의 경우에도 대부분 경미한 증상으로 파악되고 있습니다.
국민 여러분들께서는 비과학적인 공포를 유발하는 유언변화, 비합리적인 가짜뉴스를 검증하시고 믿지 말아주시기 바랍니다.
Well over 200 million doses of the COVID-19 vaccine have been administered in at least 100 nations. For more on the inoculation efforts here in the country and elsewhere around the world, I have Dr. David Kwak from Soonchunhyang University Hospital. Good to see you again, Dr. Kwak.
Good afternoon.
And I also have Dr. Katharina Song from the International Vaccine Institute. Pleasure to have you with us, Dr. Song.
Thank you for having me.
And joining our session virtually is Professor Chi-Hoon Bang at the University of Michigan, joining us virtually, of course. Welcome back, Professor Bang.
Oh, hello.
Right then, Dr. Kwak, let's begin with your assessment of the pace of the vaccination across the globe then.
Well, it seems like each nations they're doing their best to get as many people vaccinated with whatever stocks that they have. Currently, I think Israel, as everybody knows, is leading its race by having inoculated already about 50% of their own population for at least one dosage. And then they're followed by countries like United Emirates and the UK and the United States. What I want to point out in this race, though, is that there's a slight of a discrepancy between different continents in regards to having their own population inoculated. For instance, if we look at the geographic matters, North America is probably being the leading continent in inoculation, and they're having numbers that are surpassing the combination of European countries and African countries altogether. So it's something to think about. It's something we need to work on globally to sort of distribute more evenly so that the whole globe can become vaccinated and immunized against this particular disease all at once, if not spread too far away.
Indeed, a very valid point, of course. Meanwhile, Dr. Song, here in Korea, we are marking day 6 of our vaccination campaign. We've vaccinated more than 87,000 people thus far. What are your thoughts on our vaccine rollout here in the country?
So Korea initiated its first vaccination on 26th of February. On the first day, we vaccinated 19,000 people. And on second day, we vaccinated 1,200 people. And among them, most of them, over 20,000 were vaccinated with AstraZeneca vaccine, and the others were vaccinated with Pfizer vaccine. And considering that it was a long holiday throughout 27th of February to the 1st of March, the vaccination rate was not quite up to the speed yet. The government is aiming to vaccinate around 838,000 doses of AstraZeneca and Pfizer vaccine at elderly care hospital and central vaccination centers, respectively, within March in Korea, and we'll have to see how it goes.
I see. Dr. Kwak, as reported earlier on in our program, a patient with pre-existing health conditions at a nursing home has passed away after receiving the AstraZeneca vaccine. Authorities here are currently looking into the link between that vaccine and the fatality. Of course, they've found no cause as of yet. What are your thoughts on this?
Well, it's pretty much the same as with any other vaccinations we've seen so far. Even just a few months back, we've seen some of the death cases that happened timely after the vaccinations of influenza. People tend to be more heavily affected with underlying diseases. Those people who are, let's say, not able to move around more freely because of their underlying conditions, such as brain stroke or brain hemorrhages, those are the people that are more vulnerable to this state. It doesn't prove and it doesn't tell that the cause of the death is due to the vaccination, but more so they are more heavily affected because of its nature, because of the diseases that they are currently having. But on top of that, any sort of vaccinations, any ordinary vaccinations that we currently get do cause what's called hyperinflammatory state and hypercoagulable state. So that's something we need to be extra careful about, not in regards to vaccinating the COVID-19 vaccinations to people, but in regards to any vaccinations, and that's already being taken care of by the medical personnel that are currently inoculating people. So at the current state with the two cases or a couple more cases that are being reported and the couple more actually not death cases, I don't think there's much to worry about in the sense that we've already seen a very similar patterns with former vaccinations. And if we think about the death rate of elderly people or people with heavily underlying diseases, we are already seeing a quite large amount of people being affected by those diseases without any sort of vaccination. So it's not a couple of cases that we have to considerably worry about at this stage. But those particular cases, I would guess that the government will take a very close examinations into.
Right. Meanwhile, Professor Pang, what can you tell us about the post-inoculation adverse effects reported over in the US thus far?
So there hasn't really been any out of the norm adverse events after we've been inoculating millions and millions of people. You know, the side effects that you get are expected with all the vaccines, fevers, body aches. And then rarely anaphylactic cases, which is like a severe allergic reaction. There was maybe a small number of low platelet conditions that happened, but we're still not sure if it's related to the vaccine. So overall, the general consensus is that it's a pretty safe vaccine, and millions of people have gotten it, and so far there hasn't been any major safety signals. I got the vaccine, and I felt really sick the next day. And my second dose, I felt really sick the next day, but within a couple of days I came back to normal. And so overall, I think all the vaccines that we have at hand are pretty safe at this point. Yeah.
Professor Pang, US authorities recently approved a third vaccine. Janssen's vaccine will join that of Pfizer and Moderna in fighting the pandemic there. What is the latest with regard to vaccination efforts in the US, and what are some of the variables against these efforts?
So we're, I think, above our target. I think the Biden administration, they wanted to vaccinate about 100 million people within 100 days. I think we will achieve that goal and likely exceed it. And, the main issue right now is there is more demand than supply. But I think the Biden administration, they're working with companies to try to increase the amount of supplies for the vaccine. So my hope is probably around April, May, everyone who wants the vaccine should be able to get the vaccine. I think one of the biggest barriers here is vaccine hesitancy. There is a significant amount of people that still do not trust the vaccine, whether it be the efficacy or the safety. And so, and we just need to have more conversations and discussions to kind of help overcome that hesitancy that people have. And so I think that might be one major barrier that we might need to overcome here. Yeah.
All right. And Dr. Sung, staying with what Professor Pang has just mentioned, tell us a bit about the link between public confidence in current COVID-19 vaccines and the pace of the global vaccination drive.
Mm-hmm. So we can see that some countries are vaccinating with very high speed and some countries are not. So one of the influencing factor to this difference would be the social trust, confidence in the vaccine. So trust in the vaccine here would not just be limited to the vaccine efficacy. So the global trust in vaccine is important throughout all process of the vaccine, from the vaccine development to the licensure of the vaccine, manufacturing process, distribution, vaccination, throughout every process of the vaccine. So all steps need to be transparent and trusted by the public. So based on this trust, vaccination rate can be accelerated and the chain of the infection can be broken.
Right. Meanwhile, Dr. Kwok, a number of countries, including Canada and France, have now approved the use of AstraZeneca's vaccines for those aged 65 and above. Do you see these events as perhaps reversing the skepticism over AstraZeneca's COVID-19 vaccine?
I would think so. From the get-go, if we look at the results from phase 1 and 2 for the AstraZeneca's trial, they've already shown that the safety issue of AstraZeneca has no problem whatsoever working towards people above 65 years of age. It's just a matter of efficacy that they lacked evidence because they did not test in those aged people in their third clinical trial, and they're trying to come up with those numbers now. In basic sciences, really, if a vaccine has worked very well for very dispersed age groups before, it would probably mean that it will probably work as effective in older people as well. So we could sort of take a guess and that it would be as effective in the elderly people as much as they are in the younger generations. Also the fact that people, I guess, are having some sort of a distrust issues with AstraZeneca as well in European countries. More so, I've noticed that in Germany, they were having leftover AstraZeneca vaccines that are piling up. Furthermore, reason they want to make everyone who actually just wants to be vaccinated are going to let them be vaccinated with AstraZeneca's shots. Here in Korea, though, I think that matter may differ just a little bit because we're still quite lacking in the dosages. We're still lacking in the stocks. So I think the first step we should do to take care of this matter is that we need to get more, possibly, and as many dosages and stocks possible for any of the vaccines that we could get hands on. As mentioned probably before, whether it be AstraZeneca's, whether it be Novavax's, or whether it be Pfizer's and Moderna's, we just need to get as many stocks shipped in the country as quickly as possible so that we could start inoculating as many people as possible.
Meanwhile, what are your thoughts about the impact of these changes regarding AstraZeneca's vaccines in Canada and France on having an impact on the local inoculation campaign? Because we're currently not using these vaccines on those aged 65 and above.
So just continuing from my guess of how well it'll work in the elderly generations, as we see more people, elderly people being inoculated in those countries and becoming immunized against COVID-19 and showing great efficacy, I think we will feel much better about getting our own vaccinations in elderly people as well. And it's just my personal guess at this moment that it should affect in no ways in age differences. It should work the same.
Right. Professor Pang, over in the US, I hear there's been a rebound in daily cases in recent days. What appears to be fueling this resurgence?
So yes, we've seen a rapid decline, but within, I think, the past week, we've seen a plateauing of that decline and maybe the beginning of a bump, but we're not sure. And so what's causing this? And the true answer is nobody knows. We think, but I think it's probably a combination of many things. I think people are moving around more. I think people are loosening their, the mask wearing, the social distancing issues. So I think that probably is the main driver behind why things are plateauing. And there's a theoretical concern that the variants might be taking over. There's no hard evidence that that's happening, but I think that's something people are looking at. And then there might be factors that we don't fully understand yet, but right now nobody really knows. And my hope is it continues to go down, but we'll see. It's still very early right now, so we're not sure if this plateau is the beginning of something that'll go up, it'll just plateau and then go down again. We just don't know. But my guess is people are just moving around more because people are seeing that rapid decline. And Americans really want to get out and enjoy getting together. So I'm seeing that a lot around me. Yeah, that's my guess, though. Yeah.
I see. Dr. Kwak, what has been shared about the impact of our current vaccines against the currently identified coronavirus variants?
Well, the vaccines seem to be working quite well. From various test results, it has shown above at least 60% of efficacy for any of the vaccines that we're about to get, that including Pfizer's and Moderna's, but not only including that, but also AstraZeneca's and forth to come Novavax's vaccine. What I want to emphasize, also bring up here, is that the studies that were studied against the new variants that are happening in the UK and South Africa, the vaccines that we are currently getting also reduce the number of hospitalizations in those countries by vast amount. And they're mentioning numbers up to 80 to 90%, and particularly 95% that I noticed from one particular result. So we could feel quite safe and very enthusiastic going into these vaccination process. As I mentioned, we just hopefully would speed up a little more and get most people and everybody get vaccinated as soon as possible.
Right. Doctor, so what are your thoughts on delaying the timing of the second shot in a bid to offer the first shot to a greater number of people?
Mm-hmm. So at the moment, we don't have enough data on one-dose vaccination. And there are studies showing that two-dose schedule prevent variant type virus. So as the evidence we have now does not support one-dose vaccination, nor does it support to delay second-dose vaccination, we'll have to wait to more study results to see if it will be efficacious to support different kind of schedules, or even if it can be can allow interchangeability and etc.
I see. Dr. Kwok, Israel boasts, like you said, the highest vaccination rate in the world, but it has been witnessing a rebound in daily cases. How do you explain this reality?
So I actually traced back the graphs of Israel, what Israel is going through, and they're currently having about 3,000 to 4,000 daily cases, and that's still a decline from beginning of February when they actually started easing their social distancing guidelines. So I want to mention that, as Dr. Bang probably mentioned in regards to the states in the US, people are gathering more, people are having more freedom to gather. But I also want to bring out the point that ever since vaccinations back in December, now having had at least 50% of the population inoculated, even when they eased their social guidelines in early February, the number still declined to 3,000 to 4,000 of levels. Even if you're seeing a little bit of uptick in the numbers, it's still much less than the numbers that they used to have in the beginning of February. So a month later, after easing of the social distancing level, I want to emphasize here that they're still having a great effect from having people vaccinated so much. So once again, I just would like to mention that we need to follow their steps and get most everybody vaccinated as soon as possible.
Right. Professor Bang, after 6 weeks of a decline, the global tally worldwide, that is reportedly on the rise again. What are your thoughts on this? And when do you expect to see the tangible impact of vaccination efforts on the global outbreak?
So the global outbreak, so it is increasing, and I guess nobody again knows, but again, I think it's like a combination of multiple factors. People are moving more, people are going out more, gathering more because they're seeing the decline. These variants are surging, and there's suggestion these variants are more transmissible, though that's likely playing a factor. I think people are getting vaccinated, that's giving people hope, and I think that's probably playing a factor in people going out more. And there might be, again, other factors that we don't fully understand. When can we control the global pandemic? That's a really good question I don't have an answer to, but I would guess probably maybe when around 70 to 80% of the global population gets vaccinated is probably when we will have full control. I do expect during summer things will get much better because this virus does seem seasonal in nature, but most likely around autumn and winter, there will likely be a surge. With all the vaccinations happening, the surge will likely not be as bad. And then hopefully the following year, things will get better, herd immunity with vaccinations and natural infection. So I'm guessing 2022, early 2022 or mid 2022, that things will be close to normal, but it's a guess. I don't know.
Hopefully it's the right guess. Right, Doctor.
Yeah.
So fake news about the vaccines are also fueling public distrust. How do you respond to this?
Mm-hmm. So if people listen to this fake news, a country's vaccination rate will be greatly impacted. To reduce this risk, I think the importance of communication can never be overestimated. So for example, let's look into the fake news around Pfizer news being called so-called water vaccine. So Pfizer vaccine is defrosted and normal saline is mixed for dilution. And this is a standard process for vaccination, and this does not cause a Pfizer vaccine to become a water vaccine. And another example would be on human embryonic tissue. And AstraZeneca vaccine uses human embryonic kidney 293 cells to proliferate virus during manufacturing process. And the cells are originally isolated and grown in the early 1970s. And there were fake news on this vaccine, and that the vaccine was made of the abortus lung tissue, and this news was spread on the internet. So this kind of misunderstanding, the news, fake news, can be one of the cause for the decrease of the vaccination rate. So clear, understandable communication to the public is very important for the vaccination.
Of course, I see. Professor Pang, what are your words of advice amid Korea's launch of its inoculation campaign?
So, I think messaging is so important. Just telling people get vaccinated works for the people who wants the vaccine. But, there's a lot of people who still have hesitancy with these vaccines. And so, when you message when you talk to people about vaccinations, the message should be hopeful, right? Get vaccinated so that we can go back to normal. Get vaccinated so that we can go to restaurants again and enjoy Korean barbecue and soju and, just go back to normal, right? And if you kind of attach this vaccination message with a message of hope, going back to normal, I think people will accept that better. And also, don't like shun people away, like people who have vaccine hesitancy. They have it for a good reason. Talk to them, listen to them. Why do they have it? And then try to convince them, rather than saying, "Oh, you're stupid. You're not smart. You don't know what you're talking about," and that just shuts down the conversation. And I don't know if that helps. And so that would be my message. Messaging is important. Yeah.
Professor Bang, what are your thoughts on the issuing of vaccine passports to encourage the public to be inoculated?
Vaccine passports. So I don't know if it's a good idea. It just, again, to me, it's good for the people who believe in vaccines, but the people who don't believe in vaccines, once you start giving like these stickers, I just think it'll just divide people more, and I don't know if it'll help. And so, I don't know. I don't think it's a good idea. I think in the big picture of things, it'll just divide people, polarize the message more, and maybe not help. So that's just my feeling about that.
Right. And staying with that, Dr. Song, what are your thoughts on the presence of vaccine passports to encourage people to get vaccinated?
So I think I agree with the vaccine passport. We need a certificate. I think previously WHO also had some kind of vaccine passport to verify the vaccine history for other vaccinations. But for this time, we need to think about how we can verify vaccination history for COVID-19 vaccine this time around.
Right. Dr. Kwak, meanwhile, what are your prospects of Korea's COVID-19 situation in the days ahead, especially since we've just come out of a long weekend?
Right. So I think we're continuing to have a core number very stabilized, meaning I'm thinking the core number is really plateauing into 200s and 300s of a number. And then depending on the cluster infections, how many cluster infections we get on top of that is really the decisive matter what is bringing into the 400-some numbers that we had today. As you mentioned, coming off of the holiday weekends, we probably had much more social gatherings and much more proximity for amongst each other. But I'm hoping that it'll stay, the core number will stay, but we will have to focus finding out what possibly could have caused other cluster infections, what we could look for in geographical areas and social areas that we could prevent further cluster infections in the future.
One final question then, Dr. Kwok. Do you support a further ease, perhaps, in social distancing measures in the near future?
Well, that would have to be very precisely decided, meaning we cannot longer take measures on a national level because as we've experienced before, some people will complain, some people will probably go out of business if we continue to have this sort of social distancing level. I think the government is doing a rather good job in regards to trying to adjust how they're going to conduct these social distancing levels. So further down the road, I think the government will have a better idea, clearer idea of what we need to block and what not to block. So I think we're going to have better measures in the future.
I see. All right, Dr. Kwok, as always, thank you very much for your thoughts. Dr. Sung, thank you for being with us today. And Professor Pang, over in the US, thank you for your insights.
Thank you.
Right, well, that brings us to the end of this edition. Do remember that prevention is better than cure, which is why authorities are calling for continued public caution. We'll be back tomorrow at this hour with more coverage. Thank you for watching.
Beginning on February 15th, the social distancing level in the Seoul metropolitan area is lowered to 2, and the rest of the country is lowered to 1.5. Restaurants and coffee shops in the Seoul metropolitan area may open until 10 p.m. instead of 9. The restriction on operating hours no longer applies to the rest of the country. Bars and clubs, which have been closed for weeks, are allowed to reopen nationwide, but they must close at 10 p.m. Sports games can admit fans up to 10% capacity. For weddings and funerals, gatherings of fewer than 100 people are permitted in the metropolitan area and fewer than 500 for the rest of the country. However, the ban on private gatherings of 5 or more people still remains. The relaxed measures reflect the Korean government's efforts to ease the pressure on small businesses and the economy. With the danger of major outbreaks